Good day all. This lecture prepared by Nursing Education Department that represents Maternity and Children Hospital Policy and Procedure regarding Clinical Management Guideline for Newborns to Mothers who are suspected or confirmed coronavirus disease 2019. Our objectives are: clinical findings, delivery room management of neonates, neonate born to mothers with suspected or confirmed coronavirus COVID-19 infection guideline flowchart, and breastfeeding, visiting time, discharge. Neonates with COVID-19 infection are categorized based on symptomatic and asymptomatic. The sign and symptoms may include temperature instability, respiratory and cardiovascular signs, poor feeding, lethargy, vomiting, loose stools, and abdominal distension. COVID-19 sample can be taken in upper respiratory tract like nasopharyngeal swab or lower respiratory tract like bronchoalveolar lavage. Delivery should be conducted in isolation room and the mode of delivery should not be affected by the presence of COVID-19. The neonatal team should be informed and ready. The neonatal team must put on personal protective equipment, PPE, before entering the delivery room. Resuscitation of the baby preferably to be in a separate room. The number of healthcare workers handling the neonate should be kept to a minimum. Neonate team in the isolation room, they should perform hand hygiene, remove the PPE used during the transfer and use new PPE. Newborns should be bathed as soon as reasonably possible. Infants born requiring neonatal intensive care optimally should be admitted to a single patient room and N95 masks are not required for newly born babies even if they require CPAP or mechanical ventilation. Surgical masks are adequate except in the aerosol-generating procedures. Obstetric nurse should hand the neonate to the neonatal team. The stabilization of the neonate should be according to the Neonatal Resuscitation Program, NRP, guidelines. Delayed cord clamping is not recommended. And all neonates should be separated from their mothers with no skin-to-skin contact. All non-urgent neonatal care and examination should be carried out in the isolation room, for example weighing and immunization. The equipment used should undergo terminal cleaning or disposed following a biohazard decontamination protocol. Now we will speak about the flowchart guideline for neonate born to mothers with suspected or confirmed COVID-19 infection. The neonate should be admitted in isolation room with close monitoring and supportive care for high-risk or sick babies. In this case, we should trace the mother result. If the mother result negative, we will look for sign and symptoms for the neonate. If the neonate is symptomatic and requires intensive care, continue the supportive management. But if the neonate is asymptomatic and stable, breastfeeding and rooming in is allowed and discharge the baby with follow-up till day 28 of life. If the mother tested positive, collect the oronasopharyngeal swab for the neonate at birth. In this case we should trace the neonate result. If the neonate result negative, we will look for sign and symptoms for the neonate. If the neonate is symptomatic and unstable, continue the supportive management and repeat the second sample at 48 to 72 hours. But if the neonate is asymptomatic and stable, discharge once negative for 2 consecutive samples with follow-up. If the neonate tested positive, Also, we will look for signs and symptoms for the neonate. If the neonate is symptomatic and unstable, continue supportive care and repeat the sample every 48 to 72 hours until the result turns negative. Discharge once negative for 2 consecutive samples with follow-up. While if the neonate is asymptomatic and stable, repeat the sample every 48 to 72 hours until the result turns negative. Follow up through 14 days after birth, focusing on parents' education. Discharge once negative for 2 consecutive samples with follow-up. Mothers should express breast milk, after appropriate breast and hand hygiene, and this milk may be fed to the infant by designated caregivers. Breast pumps and components should be thoroughly cleaned in between pumping sessions. If the mother's result is tested negative for COVID-19 infection, breastfeeding and rooming in with mother is allowed. If the neonate is diagnosed to be a confirmed case of COVID-19 infection and parents are tested negative for COVID-19 infection, or the neonate in level 2 and 3 care, the parents are not allowed to visit until the neonate has been confirmed negative. And they can use phone and video modalities to keep contact. For preterm babies requiring a long stay, their parents can only come to the unit once they have no symptoms for at least 7 days and 2 COVID-19 tests taken 24 hours apart are negative. Terminal cleaning and disinfection of the isolation room should be done following discharge of the neonate. The neonate must be monitored until day 28 of life with the caregiver to seek medical attention if the neonate develop any signs or symptoms. In summary, we have covered all these points. Clinical findings of any sign and symptoms. Delivery room management of the neonate. The flowchart guideline for neonate born to mothers with suspected or confirmed coronavirus COVID-19 infection. And last but not least, we talked about neonatal care including breastfeeding, visiting time and hospital discharge. Thank you for your listening.